So, Francisco, how would you describe the core pillars of Dorado Health's IT strategy?
Well, we try to simplify everything, and standardization is one of the keys. We try always to standardize our processes, our workflows. The equipment that we buy is, if we buy something for one hospital, we try to replicate that on the other hospitals. The same with clinical platforms. We try to be consistent with what we have in all our hospitals, and we try to keep to work with our 5 hospitals like one system. That's I think that's part of our success.
The consistency.
Mhm.
Are there specific technologies you've implemented recently that are preparing to introduce that you believe will redefine the care in your facility?
No, we're working on a lot of projects right now. One that comes to mind is we're working with the point of care. That's one of the big ones. We're working also in platforms for patient engagement. Then we're also working in standardization of consents. That's a big one. Trying to standardize clinical consents and general consents in all the hospitals has proven to be very challenging.
So, considering that, are there any milestones or recent achievements that you're particularly proud of?
Well, I'm very proud that we implemented MEDITECH in 4 months or less last year. So that's a big one
Fantastic.
for us, yeah. And all these guys have the expertise to do it. So I'm very proud of that.
I'm sure. Well, we talked about how you maintain consistency across the 5 hospitals. Has there been any particular strengthened system-wide coordination that across your 5 hospitals that has created that consistency or community?
Yeah, well, our team is for the 5 hospitals. So we work with, for example, with MEDITECH. Is the same MEDITECH for the 5 facilities. So every change in configuration, we have to discuss it before we execute. So, and we consider we are flexible with some of them because we know that some of our hospitals serve a different communities. So if they differ a little bit on the processes, but we try to maintain a standard.
You mentioned, Paco, that you have a greater focus on data-driven outcomes. How do you measure whether a strategic initiative has truly moved the organization forward?
Well, what we do in every project, we measure what we have right now, and then we measure again when we start the project to see what's the impact, to see if we had a positive or a negative impact. That's what we do. We use the use of analytics is part of that also. So
So we've talked about the changes over the past 5 years since COVID. Any crystal ball predictions of what's happening in healthcare for Puerto Rico over the next 5 to 10 years?
over the next year.
The next 6 months. Next six
6
months.
months. I mean, AI is what we're looking at. We already started with AI in radiology. We're still going. We have ongoing projects with that in that direction, but we are seeing a lot of changes and very exciting stuff with AI. So I predict that in 1 year we see where we're going to see a lot of great changes.
Well, it's good that you're getting in on the AI. We're big proponents of AI here at Seal Shield, and personally, I believe that AI is going to be a disruptive change for the better for healthcare service for patients and practitioners. It's just the abilities of AI really solve some of the inherent, uh, bureaucratic challenges of healthcare, and the ability to have a wider look at conditions and being able to diagnose really rare situations that AI can pick up on that we just aren't able to do within the bureaucracy and the human limitations. So, really excited to hear that you're looking at those initiatives. And what, from your perspective, Eliezer, what do you see happening over the next few years? And do you see other health systems that are looking at AI or are beginning to adopt AI for the future?
I guess now they're seeing more adoption or starting to just put together some strategies. So that's one. The other thing I would think, and compliance always want to be there. And so infection prevention, all these areas that hospitals have the pressure to comply, also is going to be there, and of course, AI will help on that areas. And the other thing is that what I see is that more and more hospitals are open to evaluate new technologies. Probably in the past was not, no, they were not that open. There was much close and just were more into just infrastructure. But now, as the pressure of compliance, now they are looking for more solutions. So you can see how HIMSS is a big part of how the hospitals look for solutions, and then they are open to do demos and do POCs to just test the equipment. And we got a great example. The Dorado Health bought a few months ago a clean slate from Silcio, and first thing they was open to just test the equipment, and it was a great example of how hospitals now are open to see how the technology can help them.
So are you seeing from we're here at HIMSS, a lot of healthcare IT providers, are you seeing a greater interest from the healthcare IT community in Puerto Rico? Do you see that evolving? What is the outlook, do you think, from IT manufacturers on the Puerto Rican market?
I believe that first, the most important thing is understanding what are the needs on the industry and the hospital. I think that more and more the companies, IT companies, are just moving into understand those needs to really just come and just put some solutions that really help the hospital. Because if not, you're gonna be out of the market if you don't understand the need of the hospital or your customer. So you're gonna be out. So I guess that's the trend you're seeing, is that more and more companies, IT companies, are more related on what's happening in the hospital besides the hardware.
So looking at it from the lens of a technology partner, what kind of innovations, in addition to AI, do you think the Puerto Rican healthcare systems are asking for today different than they were a few years ago?
I will keep saying that compliance is going to be there. Anything about patient engagement, how patient experience, anything around yeah. Any kind of prevention that helps the patient get a better outcomes on the treatment. That's where we're heading.
Paco, from your standpoint, the challenges in healthcare that you experience and that you have to overcome, I'm going to put you on the spot. If you had a magic wand and you could change one thing to improve outcomes in healthcare systems like Dorado Health, what would it be?
Wow. I say
You're next.
I'd say that part of the challenge for us being a multi-hospital system is to standardize in all the hospitals. And the one I will say that if we see this like one system and try to be a standard in every place, that will be great for us. So we continually trying to innovate. That we are constantly looking for how we can help with technology, and not always is buying a software or a platform. Sometimes it's just simple changes of process and having a creative mind. And I have a lot of creative mind here.
Fantastic. Eliezer, same question. Magic wand, what would you change?
I will say that the difference, and what I would love to see, is that hospitals put together teams that are technical people, clinical people, so gonna be better for adoption. Because a problem is
Collaboration and communication.
yeah, that's key. So if I would like something to happen, is that the same kind of thing that Dorado Health put and other hospitals have put together, put those teams, and that will help adoption in all areas.
Fantastic. Well, I really appreciate you guys being on Clean Talk today here at HIMSS 26 and telling us about the Puerto Rico market. Very excited to have you guys here today. Thank you for being guests on Clean Talk. For my guests today, Eliezer Melendez and Francisco Caceres, I'm your host, Brad Whitchurch, reminding you to keep it clean.